Resurgence of COVID-19 in the U.S. and Europe is becoming more and more concerning. Here in the States, cases are on the rise, but not just in rural America, but also again in America's biggest cities. And it's all happening just as millions get ready for Thanksgiving and Christmas. Dr. Amesh Adalja is a senior scholar at the Bloomberg Johns Hopkins School of Public Health, and he joins me now from Baltimore. Dr. Adalja, how concerning are the projections that you're looking at? I mean, 400,000 deaths in the U.S. possible by the end of the year.
This is very concerning, and it's what a lot of us predicted, that if we didn't get control of this virus, if we didn't build the public health infrastructure needed to keep cases to a minimum, that we would end up seeing really mind-boggling numbers. We would start seeing hospitals get into trouble again, and all of those predictions sadly have come true, and I think it's going to be a very harsh winter.
What can we do? Not necessarily just as a country, but as individuals.
You have to remember that this virus, it thrives on social interaction, and those in social interactions where it has basically an unimpeded path from one person to another. So what we can do is wear face coverings. We can wash our hands a lot. We can try to avoid crowded and congregated places. We can be very mindful of our contacts, try to do things outdoors as best as we can if weather permits. All of those types of actions, just behaving as if we're in a pandemic, if we could, that making appropriate risk calculations will go a long way to helping our hospitals avoid crisis.
What about the holidays? What's your recommendation for what we should be doing when it comes to Thanksgiving and when it comes to the December holidays?
So the first thing is think about your risk tolerance, because you know that you when you invite all your friends and family to the dinner table, you're also inviting the virus there. So it's going to be there. And the thing is, you have to try and think about what simple steps can you do. Can you space people 6 feet apart? Can you minimize the number of people that you're inviting from different households? Can you try and keep it to people that you've already mixed with? If you're in a place where the weather is good, can you do this outdoors or open the windows to increase the ventilation? Can you have people wear face coverings when they're not eating? And all of that, I think, will go a long way to stopping as much of the spread as you can, but we know we're going to get spread during Thanksgiving and Christmas. I think it's inevitable at this point, and hopefully we can give people a toolkit to reduce the harm the virus causes, knowing that we can't get it to zero.
I'm eager to get your take on the vaccine news that we got earlier this week. Around the world, people were optimistic. Stocks shot up around the globe on Monday and Tuesday as people were optimistic about Pfizer and BioNTech's progress. But do you think we're too premature with that excitement?
No, I think it's right to be excited. I mean, this has been a long slog, 10 months since this virus appeared, and now we have a vaccine. That's record-breaking time, and it really is proof of concept that we can do this if we put our minds to it and adequately invest in it. But I would say that you have to keep in mind that this vaccine is not going to be available to the general public until well into 2021. So we can't take the foot off the gas. We still have to continue to do the same types of activities that we're doing now in order to stop this virus from spreading. We still have to make sure our public health departments can contact trace. We still have to advise people about congregated and crowded places and wearing a face covering. So I think I think there is a light at the end of the tunnel, but we're still in that tunnel, and we're not going to get that vaccine until we get through this winter. And I think that's what everybody is worried about, those hospitals really collapsing under the pressure before the vaccine is available.
Well, testing has certainly improved around the world over the last few months. In the UK, for example, the government there is considering actually whether to test mass students before they return home for the holidays. Is this something you think we should do in the US and something that governments around the world should do?
Testing is going to be a major part of how we move forward before we have a vaccine and probably after we have a vaccine. But we've just been unable to do this in the United States. We've been able to do testing for sports teams, for the National Basketball Association and National Hockey League, but we've not been able to do it for the general public. Testing isn't ironclad. It still has to be coupled with other interventions like social distancing, wearing a mask, avoiding crowded places. But it is one way to decrease the risk. And if people could know their status at any given moment of the day, because maybe they have a home test, that would really change the whole game that we're playing right now. But we're not quite there. And I do think the more testing we do, the better it's going to be, because the more people know their status, the more likely they are to isolate and not expose other individuals.
Well, I think unfortunately for us in the United States, it has become politicized, and the response to the virus has become politicized. How do you see a Biden administration handling the virus response versus a Trump administration?
To me, I think it can only get better because the Trump response has been evasion, taking the wrong actions, attacking expertise, disdaining high levels of testing because they had a kind of a scoreboard approach to this disease, thinking if you didn't test for these cases that they somehow didn't exist. And then really, I think just not actually taking the decisive actions in January and February, taking actions like countries like Taiwan and South Korea did, where they immediately developed the infrastructure to be able to have a sustainable approach. Instead, we've been seesawing between levels of control and then the virus going out of control. And it becomes very unpredictable for business owners and for everybody about what's going to happen next, because we see restrictions being put into place in counties in California, as well as in places like Minnesota. And that's not going to be a path forward that's going to lead to anything but more disruption. So we have to get control of this. And I do think that the Biden plan does outline many of the factors that we thought would be really instrumental in controlling this back in January and February. So it's better late than never. So I do have a lot of optimism about the change in administration when it comes to the pandemic.
I'm glad to hear you're optimistic. We need a little bit of that. Dr. Amish Adalja, senior scholar at the Johns Hopkins Bloomberg School of Health in Baltimore. Thanks so much for your insight. And we should also note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg. He's the founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.